Hi everyone, this is PS Ritika, a BPharm second year student who is very passionate about pharmacy, and I bring to you a session on clinical pharmacy. In today's session, we'll be knowing more about clinical pharmacy, and I have two wonderful people here who will be answering many questions that we students often have. So, starting with Ms. Krishna Suresh, I would like to introduce her as a clinical pharmacist in infectious disease and AMS KIMS Health Trivandrum. She has graduated from a government medical college in Trivandrum and completed a certified course on antimicrobial stewardship from Manipal Academy of Higher Education. She has done self-reported beta-lactam allergy, mislabeling, and inappropriate antibiotic use, which was accepted for publication in ASHE journal. She has done a study on optimization of urine culture utilization in ED, which was selected for poster presentation at Shia Spring Conference 2025, which was also selected for discussion at the Shia Science Salon, presented this at CIDS AMS meeting. She is also an active member of Federation of Clinical Pharmacists of India and also a speaker at FCPI ID Congress 2025. And our next speaker is Dr. Hafiz, who has who is a PharmD graduate from Manipal University, who has previously worked as a clinical pharmacologist in the center operation team at Manipal Health Enterprises PVT Ltd, contributing to Track Care Australia HIS or EMR implementation and digital health initiatives across Manipal hospitals in India. Currently, he serves as a clinical pharmacist and assistant professor at Arichanchandgiri Hospital, actively involved in AMSP coordination and quality improvement initiatives. He is a proud team member of the Guinness World Record event for largest CPR training. Additionally, he is a certified civil defense member and licensed snake rescuer with the government of Kerala, contributing to public safety and wildlife conservation. He is also the FCPI's co-lead in critical care forum. Now, let's move on to our session where we will know more about them and the clinical pharmacy. Firstly, I would like to ask both Ms. Krishna and Dr. Hafiz what inspired you to enter the field of clinical pharmacy?
So let me start. So
Yes,
thank you, Ritika, for that great introduction, and we sincerely appreciate your efforts in doing this program. So regarding what inspired me, I actually came to know about this program when I attended a career guidance class in my 11th standard. This concept was entirely new to me. I was very much impressed to hear that someone other than a doctor is reviewing a patient's file, checking their medication errors, and suggesting optimization of therapy. So, this concept was entirely new to me, and the idea of being a master of medicine that really attracted me. And I genuinely felt that there is our healthcare system definitely lacks such a role. So, that was my inspiration to become a clinical pharmacist.
that is great, ma'am. We would like to know Hafiz's as well.
Yeah, thank you, Hrithika, for the opportunity. Yeah, so and the first question was amazing. Yeah, what inspired me is actually I was finished my Bachelor of Pharmacy degree B Farm, and after that I selected my PharmD. If you're telling like if you're a pharmacy student, we'll be getting a lot of queries about the medication from the various part of the society, including our relatives, whatever. So with only BFAM knowledge, I was not able to give a proper answer because in BFAM curriculum we'll be learning a lot of things like about the drug manufacturing, drug research, and even pharmacognosy about the plant medical. But if you want to give a proper and scientific answer for the to the questions coming from the community, even by to the healthcare professionals, clinical pharmacy is the better option. So that inspired me to become clinical pharmacy. Even as a clinical pharmacist, we can give evidence based answer for the queries coming from the doctors or the nurses or the healthcare professionals, and also for the community we can give a better answer about the medication. So even during when I was studying my BPharm stories, how the clinical pharmacist is, making impact on saving patient lives. So that is the one great thing inspired me to become the path of clinical pharmacist. Yeah.
That was really great to know about both of you. And now I have a wonderful question for both, and that is I would like to know if you could walk us through your journey from college to your current position.
Yes, so as an M.Pharm pharmacy, I'm an M.Pharm pharmacy practice graduate, as you have already mentioned in the introduction. So as an M.Pharm pharmacy practice graduate, it was quite challenging for me to find my first job. Even though both PharmD and M.Pharm in pharmacy practice are recognized as qualifications for a clinical pharmacist by the Pharmacy Council of India, only a few hospitals actually accept M.Pharm pharmacy practice candidates for clinical pharmacist roles. So, since this was my passion and my dream, I did not want to settle for an academic job. So, I started searching for such hospitals which will allow M.Pharm pharmacy practice graduates. I contacted the HR person of the hospital where I am currently working, and he informed me there is no vacancy for clinical pharmacist at present, but there is a vacancy for a pharmacist. So I thought if I could at least get into the institution, I would be able to know about any future openings in clinical pharmacy. So I thought I will attend the interview. I cleared it and I joined there as a pharmacist first. And just as I hoped, after a month, I got a call from the manager asking whether you would be interested to join as a clinical pharmacist here. If so, you can attend the interview. Thus, I attended the interview, I got cleared, and that is how I got into my dream profession.
That is really inspiring. I think that will be helping others as well to work hard for what they wish to become in future. And what about you, Hafisa?
Yeah, actually, it was like, little a long journey, but I just compress. The thing is like, as you told, I was doing my B Farm. So in the final year of B Farm, I was like, I just go to know that is my area of interest. Even, I want to become a clinical pharmacist. So because like I was more into the clinical side, I was interested more into the clinical side. After B Farm, we can go to the various areas. There have a wide spectrum of opportunities are there after B Farm. But I just choose because even as I told, like, I was also a part of a lot of, patient, governmental, non-governmental organization which is serving for the society. So I want to do something for the patient safety. So I choose I want to become a clinical pharmacist. So after my B Farm, I have two chances. Either I have to select M for pharmacy practice as a master of pharmacy. Otherwise, I have to go for the PharmD postbaccalaureate, PharmD PB. So after B Farm to become a clinical pharmacist, I have two options, either M Farm or PharmD PB. So in the PharmD PB, like I thought of going with the PharmD PB because I'm getting 1 year internship duration. So if I'm doing 1 year complete hospital duration internship, I think it will help me to become more competent in the profession of clinical pharmacy. So I thought of going for PharmD PB. Then I after that the next step I started searching what are the best which is the best college offering PharmD PB. And when I started researching about that, I just found Manipal University is the ranked number one, followed by JSS and so on and so. So then I was started thinking, why not I can study from the best university. So I started the admission process, how we can pursue the PharmD postgraduate from the Manipal. And I started searching about the campus, about the infrastructure, and it found very impressive. So I wrote the one exam called the Manipal entrance test. If you want to become pursuing PharmD PB from the Manipal, you can write the Manipal entrance test. So I wrote the MET. The most of the questions, as you know, as a B Farm student in the final year, almost all the students will be preparing for the GPAT examination. So most of the questions what we are preparing from the GPAT, the same question only they asked from the MET. So it was kind of easy for me. So after the entrance examination, they called me for the counseling. There was 9 seats was that. After the B Farm, we will be directly going to the fourth year of the PharmD postbaccalaureate. So for fourth year of the regular batch of PharmD. So in the counseling, I got one of the seats in the M Farm in the PharmD batch. So after that, I studied this. So after B Farm, we have 3 more years we have to study. So 4 year plus 3 year, total it will be 7 years. So 2 year will be my academics. In the fourth year, when the first year I have, we are also studying the therapeutics 1 and 2, which we didn't study in our B Farm curriculum. So there will be little load of theoretical theory topics will be there in the fourth year. But if you're interested in pharmacotherapy, we will enjoy that one. So after the 2 year, we'll be having 1 year internship. So I got a chance to do my internship in Manipal, having 2 3 hospital within the campus. I did my internship from the Kasturba Medical College, which is the fifth ranked medical college in the country. So because and this thing I would like to tell to the people who are watching the video, if you're selecting any PharmD or PharmD colleges, you have to also think about the hospital which is attached with the pharmacy college. So because it matters from where we are doing our PharmD, whether the hospital is NABH accredited, whether the patient we are the how many bedded hospital, whether the exposure is good, so those steps. So in the Kasturba Medical College, it is one of the biggest medical college. We can, the one good thing is we can also see a lot of the rare cases which is coming to the hospital. So we will get those kind of exposure. And after my last year internship time, I got I got placed from the campus placement. I got job as a clinical pharmacologist at the Manipal Health Enterprises Private Limited, which is located in the Bangalore. So that was my first job. So it was the selection of PharmD from the Manipal. It was not a wrong decision, because that label, Manipal label itself, I can use for my own promotion in my future job, future growth. Okay, so when I was walking, even if I studying in the Manipal, we'll be getting a lot of network with the international students. But inside the campus only, in our classroom, we can see a lot of students coming from different countries as part of the exchange program. So so what I was telling is, during my internship time, I got placed into Manipal Health Enterprises Private Limited. I was working as a clinical pharmacologist in the health informatics. So that Manipal corporate, directly how I got the job into the corporate settings, because because I studied from the Manipal. The campus placement is really good. In my internship, in my first job, I was working in a software called Track here, which is the health information software. So by in that job, I was mainly it was one of the corporate job. All the Manipal hospital and recently acquired Columbia branches was under that corporate. So I was able to represent, the corporate, and we are getting a chance to meet, instead of working in one hospital as a clinical pharmacologist. We are getting a chance to go and meet the different healthcare professionals like doctors and the pharmacists from different hospital and solving their queries. So I was completely in the corporate sector. I was working as a clinical pharmacologist. So after 1 year of experience, I was thought of focusing more on the academic side and improving my research profile. So I shifted into Adichunchanagiri University, Karnataka, where I was working as an assistant professor and clinical pharmacist. So I'm finishing 2 year of experience in Adichunchanagiri. Yeah.
That is great, sir. I think that would be, it's like many BPharm students think about doing Farm DPV, but they have many questions. And I think you would be an inspiration for them to even work for that as well.
Yes, as
Yeah,
Hafiz
definitely.
told, when I was also wishing to join the PharmD postbaccalaureate, but later on, after I joined for BPharm, later on I came to know about the Center for Pharmacy Practice, where if you are graduate, if you are cracking a GPET examination, you can do your masters in pharmacy practice with government stipend. So I thought I'll little bit deviate my path and finally reach the destination.
Yes, that is
Yeah, both are
great
good. At the end
actually.
of the day, both are coming to the same department. Yeah,
Yes.
but the thing is, many people, just like by chance, if they're not getting the entrance, they'll be end up with the pharmacies. But instead of that, if you're having the passion, if to become a clinical pharmacist, and if you're following the trusting the process, we'll be reaching in a good position as a clinical pharmacist in some good place.
It's
So
all
we have to trust
about
the process.
your, yes, it is all about your passion and commitment.
Yes.
And don't get misguided by your seniors or whoever who's demotivating you to the path of clinical pharmacist. It's an important take home for the people who's watching this.
All right, so now let's move on to more questions. And now I would like to ask something in the educational background and entry into clinical pharmacy. So I would like to ask Ms. Krishna about what academic qualifications are needed to enter clinical pharmacy roles.
Yeah, I think this question is already answered by Hafiz. As we have already mentioned, PharmD and MPharm in pharmacy practice are the qualifications which are recognized by Pharmacy Council of India for working as a clinical pharmacist. So if you are a BPharm graduate and if you want to enter into the field of clinical pharmacy, either you will need to do a PharmD post baccalaureate. As he told, it will be you will get a direct entry into fourth year of PharmD, right, Hafiz?
Yes,
Yeah.
yes, ma'am. Yes, ma'am.
And yes, otherwise, the next option is you can complete 4 year of B Pharm and then go for an M Pharm in pharmacy practice, which is also equally recognized. But still, you have to keep in mind the challenges which I mentioned before.
Yes, absolutely. Thank you, ma'am. Now, I would like to ask another question, which is for both of you, and that is how important are internships or clinical rotations for students?
Yeah, about the how important is the internship and the clinical rotation for the students, right? Yeah, so the one thing is like, as I told, as Krishna ma'am told, we have after 5 year program, we have 1 year internship. So the internship is very important. I just wanted to add two things, like, if you are doing the internship, even you have a chance to do a, 3 month internship I would say, like, even I think PCA is like agreeing you can do 3 month externship program in any other hospital. So before doing internship only, all the family students have to set a goal. They have to decide which specialty they want to become master. Even after family, many people are working as a non-oncology pharmacist or critical care clinical pharmacist. Like Krishna ma'am, infectious disease clinical pharmacist. A lot of people are there. So we have, if we are choosing, which is our area of interest, which is our specialty of interest, we can set a goal. Then in the internship thing, the 3 month you can do the internship from any of the hospital where they are well established department is there, or under a good trained clinical pharmacist. So if you are doing is 3 months in under a trained clinical or skilled clinical pharmacist in a well established center, that is better than studying 3 or 4 years. Okay, that matters. So, for example, most of the people will be interested as an oncology clinical pharmacist. So, if you're taking nearby, if you're having in Bangalore location HCG cancer centers, so if you are doing the 3 month internship there, even you will get a chance to master your clinical pharmacy activities and skills in hematology, bone marrow transplant, solid organ or blood cancer, all those. So accordingly, and it matters under a trained clinical pharmacist you have to work. That is the one thing. And some colleges, I think, like, they are providing the internship opportunity from 5th year onwards. 5th year, like, half yearly project, remaining half year they are giving a chance to do the internship in, specialty like, cardiology, nephrology, like that. And 6th year, 6 months will be in mandatory general medicine rotations. And after that, you will be having 2 months like that, like, different pediatrics or OBG, like that, you can do the rotations. But the thing is, whenever how important is, like, internship time is the time you are implementing or your theoretical knowledge into the practice. Around maybe 10% you will be learned the theory, remaining 95% of the concept you are getting by seeing the cases from the practical side. So the internship time, even I used to tell to my students, like, if you're learning one theory topic, for example, hypertension or diabetes, minimum you have to see 15 cases or variety of cases of the specific disease. Then only you will become master in that domain. So the internship time, in which specialty you are getting posting, you make sure you are learning all the fundamental clinical activities. For example, medicine, all the normal clinical pharmacist activities will be doing in stuff. If you are going to the cardiology clinical pharmacy, we'll be doing things like, anticoagulant review, anticoagulant bridging. If it is oncology, we'll be doing, chemo drug dilution. In pediatrics, pediatric will be entirely different population when compared to the adults. So how to making the dilution protocol for pediatric ICUs, and dosage adjustment according to the per kg body weight of the child. So it will be, there are a lot of things, specific things are there if you are going to different specialty. So if you are doing the internship in any specialty, make sure you are learning most of the clinical pharmacists. You are become one of the integral part of that healthcare team. You are learning a lot of clinical skills which is necessary for in that specialty. So that department will recognize you, and it will make you expert in that area. So that's one thing I would like to mention. Yeah, and Krishna, what do you think? Like, do you
Yes.
have any?
Yeah, I would say internship and this clinical rotations are the essence of this program. As Hafiz said, like there is a huge difference between classroom learning and bedside learning. So being at a patient's bedside, observing all the clinical cases, it is different. The knowledge, the level of knowledge you get from that, you cannot get it from any textbooks. So that is entirely different. So that is what which makes it this program especially unique. It also helps you to develop your clinical judgment, critical thinking, communication skill, and it will develop your confidence in dealing with other healthcare teams. So in short, these two factors are very much important for PharmD or MPharm in pharmacy practice.
That is great. So basically, internships are really important, and that would definitely help us students with gaining skills and opportunities. Hello?
Yeah.
Yes,
Yeah.
you're
Yes.
audible.
Okay. So now I would like to ask another question, which is also very important and something that many have doubts about. And I would like to ask you guys, what does a typical day look like for a clinical pharmacist, and what are your key responsibilities, and how do you guys ensure safe and effective medication use in patients?
I think Krishna can start that one because you're working at IT physician. You can take more input. Later, I will add.
Yes, sure. So, as you were saying, I am working as an ID clinical pharmacist. So, I am specializing in antimicrobials, microorganisms, and antimicrobial stewardship initiatives. So, a typical day for me starts with reviewing the files of all the patients who were started on reserve antibiotics on the previous day. So, that is the first thing I do when I come to the hospital. So I'll ask all the appropriateness of the prescription, including its dose, duration, drug interactions, whether it is correlating with the lab parameters. Also, it includes following up of the culture reports, whether there is any pending culture reports for the patient. Then there is something called antimicrobial susceptibility testing. We have to that where you get the culture early indication of whether there's a particular bug susceptible to an antibiotic or not. So all these kind of stuff, that is the morning routine what I do, and all these findings and interventions are presented during the ID ward rounds, and we take a decision at the bedside along with the ID physicians. So that is the core of the morning routine. And after that, yes, we also do, as I mentioned, we also follow up the culture reports and antimicrobial susceptibility testing, and decides whether to escalate an antibiotic or to de-escalate an antibiotic, or should we continue the same antibiotic. So that decision is taken after following up of all these culture reports. And then later on the day, what I do is surgical prophylaxis auditing, which means you have to check whether a patient is receiving an antibiotic, the right antibiotic, before a surgery as a surgical prophylaxis. And it has to be administered at the right time and also for the right duration. So it is our responsibility to ensure the patient is receiving right surgical prophylactic antibiotic. And another responsibility is allergy management, which means that when a patient reports with any kind of antibiotic allergy, we take a detailed history of his allergy, whether which all antibiotics he tolerates and what kind of reaction he developed, and all those things we have to collect. And based on that, it is the clinical pharmacist who decide whether to tag an antibiotic allergy into the patient's electronic medical record. So it is the clinical pharmacist's decision here, and that is one major responsibility. And sometimes we also have to provide alternatives In case if the patient is allergic to a certain medications, we doctors approach us for uh, antibiotic choice. So that is one major responsibility, that is allergy management. Then other responsibilities include we are also involved in several quality improvement projects and research works, as you mentioned in your introduction. That were some of our projects. And also we look into what inpatient and outpatient antimicrobial antibiotic prescriptions to check for its appropriateness. That is not done on a daily basis, but on a monthly basis or quarterly basis we do that. And all our interventions, all we did in a month, we presented in the AMS meeting, which is conducted once in a month. So that is what a typical day for me.
That was great knowing, ma'am. I would like to know about Hafisa now.
Yeah, yeah. So that's fine. Like actually, the roles and responsibilities initially it will be depends upon the most of the things are same as Krishna had told. So morning, my routine is starting from 9 o'clock, 9:30 to 4:45 is my timing for our organization. So I am doing a double job, clinical pharmacist and assistant professor. So I was a part in our university. I was a part of pharmacy college and our hospital, Adarsh Chanakri hospital as well. So in a day, like normally morning time, if you're attending the clinical pharmacy rounds, as like any other clinical pharmacist will be doing the normal we'll be doing the prescription review, we'll be checking whether the correct the right dose, right frequency, right duration, every medication things are right, whether is there any error from the prescription error from the pharmacy side or any administration error from the nursing side, or we'll be checking any drug without indication without drug, adverse drug reaction, and like drug interaction molecules. All those things will be same like in any other clinical pharmacist will be doing if they are going for the rounds. So the main thing, like I was one of the first. I was the first clinical pharmacist appointed in the medical college. The I was initially involved in the implementation of the clinical pharmacy department. So we implemented ideal monitoring center and medical device monitoring center. So we can divide my duty from morning to afternoon, afternoon to evening. So until afternoon, we'll be maybe we'll be getting some queries from nurses or the like doctors regarding the ADR. So since we are doing, I am also working as a coordinator for the ADR monitoring center. So whatever the ADR coming, we have to document. As a coordinator, we have to coordinate, and we have to upload in the Vigi flow, and we will be directly sending the documents to the PVPI. So that time, even any whatever the type of the ADR, we will be giving the suggestion how to manage that ADR according to severity, and we'll giving the training for the people, nurses, or about each ADR in how to fill the PVPI form. So after the training, even there is an increase in the number of ADR reporting to our center. And medical device monitoring center also similarly, we will be capturing document, we'll be assessing and documenting. So until afternoon, I will be more focusing into an assistant professor activities. Even we are having our own family students in the campus. So our afternoon time, I'll be engaging with, until afternoon, I'll be doing the clinical pharmacist activities. Afternoon time, I will be engaging mainly in training the students, family students. The interns page every day we'll be having an active clinical discussion. So as my role, like all the interns, we will be conducting one by one series. For example, afternoon, what we are doing is all the intern students of our campus will be discussing about the intervention, what they did on that day. So if one person who posted in the general medicine is explaining about his intervention, every other students also can listen that, and they can copy paste the same intervention when they are going for the rounds. And we will discuss whatever the queries coming from the doctors and what their experience will be discussing over there. And also after that, we'll be having a small session kind of specialty series. For example, 1 week, if you are selecting the subject cardiology, we'll be continuing the different aspects of cardiology clinical pharmacy on one day, each day. So they'll get an overall understanding, okay, what all we have to do, what are the things we have to learn, how to approach the patient in the cardiology, like that. And next week, we'll be focusing on nephrology or infectious disease, or also like that. So after we'll be like that. And in between, since we are having students, it is a better opportunity to start, to participate in research also. We will, so I am doing research with the B pharmacy students as because they are fourth year, they have to do one research. So I'm getting 4 students, and also evening time I'll be spending with them, and also with the family also we are doing some project. So currently around with the different department like dermatology, OBG, and pediatrics, we are currently ongoing 6 ongoing projects are there, and we also published one systematic and meta-analysis in Scopus Index to Q2 channel, and one study from a medical device monitoring center. It's very underexplored area. So medical device, there are a lot of job opportunities also coming nowadays. So if we are trying to train the students in material vigilance as well, and recently we published one study from in Q2 channel from the material aspects, and we'll be and collaboratively doing research work with the dermatology people, because whatever the case report, they will only come and collaborate with us because they also want publications. So if we are giving helping in the publication, they will help us in the clinical learning. So these things will be involved most of the days. Most of the day we'll go like this, but every Friday we will be having a discussion by all the family students, where the senior family students will be teaching to their juniors what they have done. And for the best intervention, we'll be giving award in that Friday meeting, monthly ones like that. So these are the things as an assistant professor and clinical farms point of view I'm doing. But these things will be varying from hospital to hospital or organization to organization according to the job role, whatever they are doing. So this is from what we do normally in the hospital.
The interns who come to Hafez Hospital are really lucky,
Yes.
right? Because they are,
Yeah.
as Hafez is saying, they are getting a lot of opportunities to learn and to teach, and yes.
That is
Yeah,
actually
yeah, that
very
is true.
much
But somebody,
beneficial for our students.
Yes.
Okay.
yeah, even
So
but as I told, even that is one factor. But if somebody wanted, maybe they'll be having their own patient only in infectious disease like that. Those interns, instead of coming to our place, they have to do under someone like Krishna ma'am, because they have to improve their skill under an expert faculty. So it's first the students' patient matters, to which stream they want to focus. Yeah. So even we are having our own student, and we are also planning to call for people from open the internship opportunity to the students coming from different colleges as well soon. Yeah.
that would be great, sir, because it is so
So
beneficial for
you
the
may
students. Yes, ma'am, you
Yes,
may
so
continue.
Hafiz were saying that they used to discuss about the interventions. So that is the best way to learn things. When we discuss our interventions and what all queries we got during that day. When we if we are discussing all those in a meeting, then that is the best way to learn and to teach students.
Yes, ma'am. Actually, what from the students discussing, we will also as a staff, we will also learn a lot
Yes,
of things
yes,
from
yes,
the
yes.
students.
We'll also learn.
Yeah. Yeah, and if next time, if if you keep on listening those intervention, next time if we are reviewing one patient, immediately we can find 3 4 interventions. The common errors easily we can identify, and we can communicate and solve before reaching the patient. Let's say is correct point. You told, yes.
Yes, also next time when we get a query, it will be easy for us to answer.
Yes, correct. No,
Okay, so I have a question. That is, what is the current scope of clinical pharmacy in India and abroad? And also, I would like to ask, what are the top 3 skills that every clinical pharmacist must have?
Okay, regarding skills, I'll speak first part, Hafs can take.
Okay, so what are the scope of clinical pharmacies? So I told previously we were in the era the pharmacies. There's 3 type of pharmacy basically. Like in the community pharmacy, hospital pharmacy, and clinical pharmacy. So as a pharmacy, initially we were only dispensing the drugs. From that, now there are a lot of scopes in the current era. We are having a lot of scope for the clinical pharmacy. So clinical pharmacies nowadays, the NABH or most of the hospital accreditation, they're demanding they want the clinical pharmacists in the hospital, because they're also one of the integral part of the quality enhancement process or key performance indicator. So I'll tell what is that. So in a hospital, for example, how the clinical pharmacist scope and how it will be helpful for the hospital. Many people will be having the similar doubt. The farmers, they will think like in the pharmacy will be like only dispensing like that, but it's not like that. As a clinical pharmacist, for example, I told we will be finding a lot of medication errors. Or a different type of adverse reaction. Okay, so for example, if you are focusing one example of medication errors, so 1 month, for example, we will be doing the prescription review. We will find is there any how many errors are developed in terms of dose, dosage, frequency, duration, or we will categorize into minor, major, severe error like that. But the thing is like for example, in 1 month we are getting 80 percentage from the 400 prescription we reviewed. We found around around 70 percentage error was there. Then we will do, after finding the error rate, we will be doing the root cause analysis. Why the errors are developing? Okay, so what is the reason for the errors are developing? Then we will be doing the CAPA, which is corrective action and preventive action. How we can reduce this error rate? Okay, so maybe in that involved, we'll be training the nursing staff. We'll be, maybe, for example, the errors are coming from the nursing side, means we'll be conducting training program for them. We will be discussing the errors, how to mitigate in from future to occur similar error. Then after introducing the CAPA, corrective action and preventive action, we will assess next month how many reduction in the error percentage happened. Previously, last month we got 70 percentage error. It is reduced into 65 percentage. That 5% reduction also is a quality indicator for NAVs or any other people are coming. We can show the data because of the clinical pharmacist intervention, because of the corrective action, preventive action. We were able to reduce, the clinical pharmacist can reduce the error rate. So as you know, the medication error is the leading cause of death world. One of the major cause of death is disability worldwide. So clinical pharmacists have a better role in reducing the error rate, so in helping in the quality, improving the quality of the hospital. So these are the one of the main areas I would like to mention. And apart from that, clinical pharmacist having a lot of scopes, nowadays various domains are coming like health informatics, personalized medicines, precision medicine, all this area, the clinical pharmacist roles are involving. Even most of the companies in Bangalore side are taking clinical pharmacists into in this innovative area, like artificial AI and ML. Even I worked in similar area, like electronic health records, health informatics side. It is different exposure for the clinical pharmacist. And in abroad, if you are going, for example, somebody wanted to make more money, they can even try to write the abroad exam, and they're having a lot of scope over there. But the process will be different from country to country. For example, somebody wanted to go the recent trends. I can tell in the last 2 years, there was they put Australia, for example, Australia put pharmacy in their skill list. That means there is a higher demand for that profession in the country. So it's like a bumper offer in a supermarket. If they're getting, there's more chance of getting that job. So most of the PharmD graduate, what they did immediately after finishing their PharmD, they are writing the exam, CABS. Now it will call Opera exam. They will clear the exam and they will do the document verification. They will do the internship, and after that again one written oral exam, then become registered pharmacist. And also there will be some point system. So if you are reaching the 90 point, they'll be having the English proficiency test like PTE, OET, IELTS. And if they are reaching the 90 points, they'll be getting the permanent residency, and they can settle and can go for, after they become registration and PR, they can also try for various domain like clinical pharmacy, research, academics. All these are various scopes where we can earn a lot of money. Like currently I think it's like 10 to 12 lakhs per month is the current salary for the people who is going to trying to go abroad. Even the same process is enough. The Opera exam, same process, is enough for to become a registered clinical pharmacist in registered pharmacist in New Zealand as well. Like that, depend upon the country, they will be having their own procedure and protocols. Even UK means like if you wanted to go UK, first we have to study there, then only we will be writing the exam. But in other countries like Canada, Australia, you have to write the exam and you do the internship. So in UK means there will be 4 universities, mainly Aston, Brighton, Sunderland. They will be offering the OSPA program. So after this overseas OSPA program, it is available in PG diploma and MSc. After we are finishing the OSPA, we can write the exam. Then we will become the pharmacist. We can go to the academics where they're having different scopes. Even in UK, there's some course, many people don't know about that. There's some courses called a prescribing pharmacy 6-month program. After that, they can be, as a pharmacist, they can prescribe the medication. So they'll be getting per hour, they can make a lot of money. Plus OSPAP plus the prescribing pharmacy course. And if somebody getting the job, most of the people who is going through the OSPAP program, they will be get placed in the by the NHS, National Health Institute. So by NHS, if they're getting job also, they can make a very good, promising career over there. So like that, in abroad, there is a lot of opportunity, and in corporate sector also. After classes, clinical pharmacists, they will be also eligible to go in the corporate sector for the pharmacovigilance, medical writing, medical coding. There are a lot of areas are there because in nowadays most of the top 10 multinational companies, they're actively recruiting health science and pharma people. Okay, so the thing is like, it's very competitive, it's very highly competitive. But even one of the experience from my students and my colleagues were telling, even my classmates, majority of the students got placed in the MNs, they're working in the multinational companies. What they were telling, for PharmD, they're having huge respect for the doctor pharmacy graduate, having huge respect in the company. There are, many are working in the US based company. So they're having a lot of scopes for clinical pharmacy in corporate sector, in academics, and in hospital. As I told, NIBH and NMC guideline hospital having huge demand. They can be part of medication therapy management and other accreditation process. And abroad also they are having this kind of scope. So like in this short time frame, this is the insight we can, I would like to share. Maybe in another platform we can have a more discussion about that one. Yeah.
Thank you
So
very much, sir.
regarding, he said about every aspects of that different examinations, and he covered everything. So regarding what important skills for that is required for a clinical pharmacist, I would say first one is critical thinking, because we learn many things from textbook. There are guidelines, recommendations, but what to apply when and to whom is a question. So you should apply your critical thinking to take a decision, and the decision should be based on individual patient situation. That is very much important. It should be based on individual patient situation. You cannot follow a standardized guideline for every patient. It is not like one size fits everyone. So that critical thinking is very much important. And you should have thorough clinical knowledge, but you should be able to at the same time, you should have that critical thinking to decide what to apply when and for whom, as I mentioned. So, and next thing I would say is effective communication, because we are a part of a multidisciplinary team. So we will have to communicate carefully and respectfully. That is more important. We should have that communication skill when we have to communicate with doctors and nurses and other healthcare practitioners. At the same times, we'll have to counsel the patients. We'll have to communicate to them regarding their medication history, their allergy history, and all such things. So communication skill is also important for a clinical pharmacist. As like in any other profession, it is very much important for a clinical pharmacist. Then next is I would say it is the willingness to learn, because clinical pharmacy is a constantly evolving field. Guidelines changes, and the new medicines emerge, evidences emerge, and you should be updated, because this is very much important. Your consistent willingness to learn and stay updated is which will help you to grow in this field. And this is also important for best patient care. So I would say critical thinking, communication, and the willingness to learn are three most important skills for a clinical pharmacist. Have want to add anything?
Yeah, the same thing, even it's a good insight for, I will share these things to my students also. It's very, yeah, I have the same comments, yeah.
That is really a lot of knowledge we are gaining right now. Um, Now, I would also like to ask this question to Hafiz sir. Like, what tips would you give to someone who is preparing for their first clinical pharmacy interview?
Yeah, regarding first clinical pharmacy in okay, yeah. So interview tips, like yeah. So maybe I can tell something from my experience, because recently few of our students passed out. It was graduation got over the last week. So how they we are training them. How what is their experience and my experience. I will just take in brief. I will just take one or two example. The tips is most of the clinical pharmacist interview. There will be technical rounds, HR, and followed by HR rounds. Okay, some places they will be having a written test also. For example, Believers Church Medical College, one of the well-established clinical pharmacy department under Dr. Grace. So there'll be a lot of people will be coming for the interview. So under from initially they'll be conducting the written test. From that they will be taking for the further proceedings like other one-to-one interview and the HR interview. But some hospital they'll be having they'll be having the technical round directly. So the tips as per se in the technical round, maybe they will be first initially they will start like introduce yourself and for checking or introduce about your family. They will be asking how enthusiastic we are, how is our English, how fluent we are, how active we are. Will be assessing those things. Then there will be the most some questions they might be asking. Most of the interviews are how what are the things you did in your last organization or in during your internship. So we should be able to tell in a flow, what are all the activities as a clinical pharmacist we did in our internship time. So that time they may ask the back question, for example, if I am telling I have reported a lot of ADR, I find drug interaction. Then the interviewer may ask us tell any example of ADR you have reported or examples of drug interaction which you are become the part of. So there some people will go stuck. Okay, so I will recommend you can learn by heart and go for the interview. One common ADR example, one or two, or common drug interaction example. And I will tell my students, while answering that question, you just imagine 5 points. For example, what is the ADR you reported? So I'll tell them to remember the five integral point, as a tip, why the patient come to the hospital, what drug caused the reaction, and what is the reaction happen, how managed, what is the outcome. For example, somebody quoted, for example, in a common pedal edema because of the amlodipine. So patient come to the hospital and diagnosed with the hypertension. And what drug? Amlodipine. They have prescribed amlodipine, followed by after 2 weeks, patient developed pedal edema. So that is the reaction. And how they managed it. So management that they can tell either they stopped the amlodipine or changed it from amlodipine to other antihypertensive like telmasartan, another antihypertensive. And what is the outcome? The pedema got subsided, it got reduced, patient recovered. So like that, these 5 points, if they're remembering in that flow by without missing any important point, they can perform in the interview. Or even similar with some Apollo hospitals, when one of students was telling, they will pass asking the example of drug interaction what they have performed. So while answering that also important, how much quality content if you are giving in the short time of short span of time. So then only we can impress the interviewer. So the student we will tell similarly with 5 points. Why the what is the interaction? What are the drug involved, and what whether it is a pharmacokinetic interaction or pharmacodynamic interaction, and what are the things happened to solving that interaction. For example, my experience I will tell. So in my similar question came to me, I told the interviewer the patient have come to the hospital with a complaint of the patient was having TB, active TB infection. Patient was taking rifampicin, and also patient was having fungal infection. For that, patient was taking fluconazole. So then we will start. There is an interaction between drug A and drug B. So the drug A is the CYP3A4 enzyme inducer. It will increase the metabolism and reduce the concentration of drug B. So what is the mechanism? And after telling that one, how we managed that one, how the drug interaction as a clinical pharmacist, as Krishna ma'am told, by using our critical analyzing capacity, whether we adjust the timing instead of giving together, we put a time gap to our interaction, or whether we find any other alternative. In that case, I told my doctor, when my beloved Dr. Rampart, he was one of the inspiration. He will involve the in Kasturba Medical College, he will involve clinical pharmacists or the family students in most of the, he will ask the queries the medication queries directly to the family student. He was one of the best doctor I have seen. So he will listen. He's such a knowledgeable person. He will listen the things what this from pharmacist point we are telling. So I suggested, the patient having interaction between rifampicin and fluconazole. Why not we can change the fluconazole into any other antifungal? When I checked, I found that the amphotericin B, one of the other antifungal, doesn't have an interaction with the rifampicin. Why not we can? Then the doctor told, but amphotericin B is very costly. But our patient is coming from budget, low budget area. So again, one more point. We are also we can also involved in the cost optimization. So that option we removed. Then we were tried like increasing the dose of other drug, because the interaction is telling one drug will reduce the concentration of other drug. So we give in higher dose to compromise that. So like that we manage that intervention. And after that intervention, even others people, until that time nobody was looking us, nobody was responding us. But after that, other team members in our medical course, they'll be having PG doctors, junior residents, senior residents, other staff, in the HODs, professors. So the next day they will be looking us also with kind of, okay, oh, he's having some stuffs. He can contribute to the, then even the MBBS students having that, those people having the ego, next day they'll become very friendly. So once we start giving the intervention, they will start considering us. That was what I am telling. Okay. Yeah, the interview, come to the interview thing. So in the interview tips, one is like this. So we'll be able to answer like this. And another thing is like, after that, we are telling about technical interview and the HR interview, correct? No? So in the technical interview, they will again ask what all things you did in your last company and how you will contribute to our hospital. What all things you can do to for our hospital. So you can tell similar things like, help in NABH, those things, everything. So you should be having an idea as NABH point of view, what is the role of clinical pharmacist. They'll be mainly dealing the criteria 3 management of medication and these policy things also. Then in the HR interview, many people, even they are performing well in the main interview, HR interview, many people will fail, because they will ask how, if you are selecting into our company, how long you will work in our company. Some people will tell, I want clinical pharmacist. If I am joining as clinical pharmacist, I will work 1 or 2 years, then I will go abroad. That time only their impression gone, because company wants stability. They will be look. Even I lost one interview in Aster Hospital because I told I work 2 years. I was very sincere. I told I work 2 years and I'll go then abroad. Then rejected. They rejected me. So they want the people who will work long term. So we can answer that question like, sir, I am ready to work in your organization more duration or more years if my appraisal, my growth and learning exposure is better. Like that kind of answer if you're providing, it will be impressive. We are not telling any lie as well. Okay, so and similarly, sometimes they will ask in the HR interview, what is your salary expectation? So some people will tell, even salary not matters. I will be ready to work in 15,000 also 20,000 also. I want exposure first. That is not the way. Some people will tell like, I want 50,000, 55,000 like that. So we should not approach this kind of question like that. We can tell, according to my market research and my skill, I'm expecting a salary between the range. Instead of telling a simple figure, you can tell like I'm expecting between 35 to 40, 40 to 50, and I'm also ready to negotiable like that. This kind of simple things, if you are telling answers, if you're telling the interviewer, we can make a better outcome. There's more chances of getting job. So these are some of the area I would like to mention. And Krishna, having any point to add to this one?
You mentioned all those aspects.
Yeah, so it's like the more the experience, the knowledge, and the practice we have on it, it's better for us in during the interviews.
Yes, ma'am. Yes.
Yeah, that was great. Thank you, sir. And now I would like to ask a question to both of you, which is now, are there any like certifications and courses that would boost a clinical pharmacist's career and skills?
Yes, there are many certification courses available, both paid and free. But I'm not very sure about how much value these certificates are hold in formal interviews. But they are definitely helpful for your learning, for you to develop a skill and practical understanding. And once such platform you can follow is definitely FCPI. It provides high quality, expert-led contents, all of which are free, and you can watch them in their website or through YouTube channel. So these all these sessions are delivered by expert in their field. So these are such high quality uh, contents. And in addition to such short courses, there are courses provided by different national and international organizations, different fellowship programs which are provided by these institutions. And if you want to if you want to specialize in a certain area, like infectious diseases or oncology or critical care, there are different institutions which provide fellowship programs, mostly 1 year fellowship programs, and you can go for that if you want to specialize. And one such program which was recently launched is the ID Fellowship Program, which was launched by the IPA, in the Indian Pharmaceutical Association, which was specializing in infectious diseases alone. So there are many different courses, but the only thing is, more than adding value to your CV, it is important to improve your learning, your skill, and to develop your clinical knowledge. You should be depending for that.
Definitely, man. And Hafisa, would you like to add any point?
Yeah, similar things only what I have told, but I just would like to mention few more things. Because many like as a BPharm students or pharmacy students, you will be aware, like many organizations are conducting the programs for business purpose. So they will be giving a lot of false promotion. They'll be telling like if you are doing, you'll be assisting in the placement, so and so. But the thing is like many will be conducting for the business purpose and does not have any value. But if same time, some government organization like Indian Pharmacopoeia Commission conducting the under pharmacovigilance program of India, will be organizing more frequently about the pharmacovigilance certificate course or material vigilance certificate course. So those having more values from the government side, government certificate, even we can show in the interview and all can submit that it's a government certificate, correct? And that is one thing. And for like the question is like for certificate and skill program to improve the clinical pharmacy expertise, right? So there's one thing which I would like to mention. Most of the things Krishna ma'am told about the fellowship and that. So one is like BCPA certification. So that is also very important certificate. We can find many sources to know about the BCPS. The thing is like why I am specifically mentioning BCPS. Many people in our country or many students don't have an awareness about what is BCPS. It is an American certification. So once we become a BCPS certified pharmacist, we become board certified, worldwide recognized. So any part of the world, if we are going, if we are telling if we are a BCPS pharmacist, we will be having an additional plus point. You will be having more credibility. Even in salary also, instead of normal salary, we'll be getting 3 into salary. So all the aspects is a very good thing. So for writing the BCPS examination, we should have minimum 3-year experience as a pharmacist, clinical pharmacist. So 3-year experience mandatory. Otherwise, there is two eligibility criteria. Either 3-year clinical pharmacy experience, or you have to finish the pharmacy residency program. So, if you are clearing the pharmacy residency program from an American ASHP accredited institute, then also you can, without any experience, you can directly write the BCPS exam. Clear. So, okay. So this BCPS exam, we need 3-year experience, and after the BCPS, even we can also try for other board certification examination or certificate conducted by the America. For example, BCIDP for the infectious disease pharmacist, board certified oncology pharmacist, board certified critical care pharmacist. So like that, many specialty it is there. But if you are clearing that exam, even we can in future, if you are applying for the job like in oncology pharmacist, who are having the BCOP, having additional preferences. Everybody having shot. These guys will be having one tie also. Like additional preference they will get in the interview and all those things. So especially in the Middle East countries, UAE, Abu Dhabi, because those places they're highly recognized in the board certified people. We can see many people coming from the Egypt there. There will be in the manager position because they're coming to Dubai after clearing the other exam plus BCPS. So BCPS examination always giving us a lot of importance. So that's one certification. Apart from that, the fellowship program, as Krishna I'm told, I want to add 2 more things because recently they called one fellowship by Tata. Tata Mumbai. So in Tata Hospital, the fellowship is in oncology. And one good thing is many people may not be knowing that one. They are giving same importance for MBBS plus MD pharmacology and clinical pharmacies, PharmD. There is they're giving almost similar importance for PharmD students also, MBBS plus MD people. MD in pharmacology. That is the criteria to apply for the fellowship, and that is the 1 year fellowship. Even I have friends who cleared that one, who recently wrote the exam. My students also wrote the exam, but we should having good knowledge in the oncology. They used to conduct one exam, then interview. This time they didn't conduct the exam directly; they start the interview. So they will be asking more about the oncology, general pharmacology, drug calculation, adverse drug reaction, general pharmacology questions, those stuffs. Okay, so if somebody preparing for that one in internship time only, they can start preparing for the exam. But the only thing is, in all India, there will be only one seat. One or
Okay.
two, one seat, I guess. Yeah. Then similarly, recently the current active application, the Sri Shankara College Cancer Hospital in Bangalore also called the fellowship exam. So whoever watching this video, they can also apply for the exam. Currently, it is open. Next in August 7, I think August 17 or 18 is the exam they are planning. So that is also fellowship program. The stipend is good. So it is in oncology. They should be having good knowledge in the oncology. The total vacancy is two. And in HCG Cancer Center also, under Dr. Priyank Tripathi is one of my friend and my mentor. So under Priyank Tripathi also, like in HCG Cancer Center, there is fellowship program is open to apply now. So they'll get the information, or we'll give the link below the video description maybe. Okay, so these are the fellowship exam and the residency program also. That is also one of the skill requirement, or in a good certificate, or the for the clinical pharmacy. Residency I already mentioned. In India, I think JSS having the residency program. JSS Mysore, they are having residency. I think after, what is residency? After PharmD, if you want to become master in one area, for example, after MBBS, MD in cardiology, MD in nephrology, like that. After PharmD, which is 2 year program, PGY1 and PGY2 program. Okay, so after this PG1 and PGY2 thing is, will be more focused into one specific area like oncology. As JSS having oncology in infectious disease and emergency medicine, I'm not sure. But if you're going to north side, the Parul University, one of the institute of eminence in the north side, Parul University also offering the residency program after PharmD. The thing is, like, if you are doing the farm deed, we may get more salary, or we'll be getting more opportunities, we'll be more skill expertise. That the best thing in that domain, will be having more skill. But the important thing is, you have to cross check whatever the organization conducting the residency program, whether they are having the ASHP accreditation. Otherwise, it's like, there's not much use. ASHP means American Society of Hospital Pharmacy accredited residency program, means if you're going abroad also, we'll be having more scope. So if ASHP accredited also, we have to cross check. Even nearby, I think Cleveland Clinic, Abu Dhabi, Cleveland Clinic, one of best hospital in UAE, Cleveland Clinic also having the, I think, ASHP accredited residency program. So these are the common certifications where they can try. And apart from that, just one point, the before selecting the certification, or the skill programs courses, they have to make sure which is aligning with their area of interest and passion, or somebody who are working in the critical care and emergency medicine clinical pharmacist. They can also try, ACL. Even I recently qualified that one called American Heart Association ACLS certification. BLS and ACL means basic life support and advanced cardiac life support examination. So this anybody can try, who's interested in the critical care, or even like it will be very useful to incorporate the American Heart Association guideline into practice. It will make us more skillful, more confident to work along with the other healthcare team. Okay, so even somebody is interested in the teaching side, again, they are having more opportunities, because first exam will be ACLS and BLS provider, followed by they can, even family students, graduates also, they can try for ACLS, American Heart Association ACLS instructor exam for teaching. So that is one of the opportunities. Even they will get a chance to teach, nurses, doctors, or HODs of the critical care, like that. So that's a good opportunity, and even they will get the stipend money for that. They'll be able to travel across the country, and wherever they are going outside the country also, this examination will help us to in earning aspects, in exposure aspect, it will be very helpful. The exam name is ACLS by AHA. Like that, AHA also conducting PALS exam for pediatric department, ATLS for trauma care. So like that, many certificates are there. Even family care. I know some, families, especially in Middle East countries, the hospital will ask whether if you want to work as a clinical pharmacist, whether you are having the ACLS certification by AHA. If we are having that, it will increase our, chances of getting job. They will be having more consideration. So who are going as a clinical pharmacist in abroad, they can consider taking this, this certificate as well. Yeah. So these are the some points for both certification from my side. Yeah.
That was really good to know, sir. And I think this is really going to help our students so that, we could browse and find internships and fellowships that we could work on. And now I would like to ask a question to Krishna ma'am. What are some challenges you face in clinical pharmacy practice?
Yes, speaking about the challenges, one of as we know, clinical pharmacy is still in its early stages in India. So one of the biggest challenge that we have to face is that we have to take initiative ourselves to prove what value we bring as a clinical pharmacist, and you need to consistently demonstrate your role. You have to gain trust from doctors and management, and you should make others aware of how your input can positively impact patient care. So that is one major challenge which we are facing, that is we have to prove ourselves what all we can do in this field of clinical pharmacy, how can we contribute to the healthcare team. That is one major challenge we are facing. And sometimes the other thing is, even when you are clinically right, there will be situations, it is most sometimes difficult to change some long standing practices. There will be some senior physicians who may not be who will be resistant to change. They may not be ready to accept our suggestions. So one thing to overcome this is our consistency and perseverance. So these two factors are very much important in this profession. Because since we are, as I mentioned, since we are in this growing stage, these factors are very much important for us to grow. And another challenge I would say is the lack of clarity about the roles and recognition. In certain institution, there is still a lack of clarity about the roles and recognition of the clinical pharmacist. And coming to the financial aspects, there is a significant problem because the salaries for clinical pharmacists are still relatively low, especially when compared to the level of education we have and the responsibility of the role we are holding. Compared to that, the level of the salary we get is comparatively less. And that is one challenge we face. And also, when it comes to career progression or promotion, there are still some challenges we face in certain institutions. So I think these are some of the major challenges which we face as clinical pharmacists.
Thank you,
I think
ma'am.
like I guess I noticed one point about the salary, because like that is one area I think debating with the student. The thing is like salary. It was I'm agreeing with what Krishnan was telling, but when compared to the old scenarios, there are a lot of changes in the current
Yes.
practice. Even I know there are clinical pharmacists who's earning six-digit salary per monthly. Even I'm not willing to not mentioning any names or like that, but even just start with my student, recently passed out student. One of our student got as a clinical pharmacist in medication therapy management, 45,000 salary. So it's like because she was afforded an opportunity in the, US based company, but she's kind of corporate but clinical pharmacist job only. Even there are recently even MS Ramia or like some hospitals. Okay, the it's like initial salary will be less. You most of the hospital as a fresher they will be giving less salary, but we have to just focus on improving your exposure and skill. If you are having the good skill, salary will follows you. For example, I know people after initially start with less salary, then the next jump they will be changing into another hospital with more salary, and after making skill they'll be keep on jumping, but it will affect the stability as well. For example, my story also, initially I started with very salary, like kind of 28,000, but after the PF and everything, some 23 something I'm getting, that also in Bangalore. At the end of the month, my account will be empty. When I was like scanning for some payment, my phone will tell phone pay balance is zero. So I'll get an okay my salary, but there's no saving, nothing. But my first next jumping will be for 45. And after that, now I'm getting above 50. So as a CP, there are many CPs are earning, near 80,000. Even I personally know many people. But they'll be how initially all are start with very less salary, but you have to know some area, how to self-market ourselves. Many people are lacking in this area. They're having very good knowledge. But if they know how to self-market ourselves, for example, myself, I will tell you, I studied from Manipal, that Manipal lab, I can know. Even if you're working in any good organization like, Apollo in Bangalore, in India, if you are taking Apollo Hospital, Fortis, Manipal hospital chain, like that, Sparsh or Fortis Apollo. So these hospitals, if you are working, that label will be very helpful. Wherever we are going in the country, people will be knowing, okay, oh, he's from Manipal, he's from Apollo. Okay, or even interview, you can tell I experienced as a clinical pharmacist from Manipal Hospital. So that label will be, even we can use for our self-marketing negotiation. It's kind of some tips people can use. And there is something called a corporate combo for many strategies, how to, impress them, our communication, lot of factors, even the recommendation and our networking. Because many people are end up in high salary job, mainly through the referencing and recommendation. So even how much if you are good also. Even my brother also told me recently one thing, in corporate or company, getting high salary job depends upon 20% of the skill matters, but 80% is the recommendation matters. If somebody in the good position from the company is there to refer us, recommend us, helping us, then there's more chance we are getting good salary, good, high earning profit job. So these things, but salary, many people now are having the thought like, clinical pharmacists are earning less salary. But if you're thinking long term, maybe clinical pharmacists can earn more. But another example is like, if you're working in India, initial 2 year will be we have to work for less salary, but we can learn the job. But after that, if you are going abroad more than corporate, many clinical pharmacists are giving more salary, very handsome salary, especially Qatar, Hamad Medical Center, they're like, and government hospitals in the Dubai, Abu Dhabi, John Aramco, Cleveland, they're having very handsome salary. But how? Because if they need the people who is having the clinical pharmacist experience only, who are having corporate experience, they will not get much salary. So what I am telling is, initially, if you are working as less salary as a clinical pharmacist, later we can, plan for better salary. But initially, you are working in good salary in corporate, maybe they have to continue the same salary for a long time. It all depends. Even corporate people are also getting 6-digit salary per month. Depends upon how their network building, how their, even the FCP is a better platform. We'll get a lot of network with working clinical pharmacists who already have a good position. So, and our communication, how we are, our fluency, our language, and our, referencing by somebody from good position, our network, all those things matters. And the blessings, the factor color blessings are the matters. Because yeah, even I reached here not because of my skills. It's like because of some like or blessing, whatever we tell like that.
Yes, again, it depends upon the hospitals. It varies according to the hospital and the settings where you are working. It is if you are working in pharmacovigilance and associated with IT companies, they get more salaries than those who are working in hospitals. So it depends upon the hospitals or the settings where we are working also.
Yes.
Thank you, sir. Thank you, ma'am. Now, I would like to ask a question which is also asked by many students. So, I want to ask is this feel like more patient interactive or desk based?
it's for me, right? Whether the this one is like patient interaction based or desktop based, like that. So yeah, actually it is both. Predominantly, it will be like patient interaction oriented. As a clinical pharmacist job will be mainly patient interaction oriented, because they will be attending the pre rounds, post rounds, they will be attending the ward round participation. They will be going to the patient bedside for giving the counseling about the medication counseling, medical device, or like insulin pen counseling, or inhaler counseling, or discharge medication counseling. So always they'll be having predominantly it is there, like I can tell patient interaction is there. Even but predominantly, even if it is a, it depends upon the hospital, because some hospital they'll be having electronic health record. Okay, so in that scenario, by sitting in one place only, they can track all the patient who is admitted in different floor or wards, like that. And also for the documentation purpose, every clinical pharmacist document is a very important thing. So for documentation and also answering any queries coming from any doctors, they will be doing the literature search. They will be having the subscription to the drug reference app, preferably Lexicomp up to date. These are the FDA approved drug reference app. So hospital will be having the subscription for that. Any good organization, they will be giving purchasing that for the clinical pharmacist department. Okay, so that all the literature search, research things will be going through the desk based only. Okay, so but you have to think one thing, and somebody the clinical pharmacist working in the corporate sector also will be desk based predominantly, because they will be giving the computer or laptop and they have to return before resigning. So, but if you're working in the hospital, it will be mainly patients oriented. I will just add one more thing. It will be useful for the, it's a kind of new things which is exposure I got, I would like to share. So, but I told about my first job. I was working in a software called the Inter-System Tracker. So it was the software provided by the Australia, and we are getting the we are getting the training from the Dubai. So what is the beauty of this software is, as a clinical pharmacist, pharmacologist, I was working on the pharmacy module of the software. This track here means all the hospital, Manipal hospital across the India, around 23, now it is 28 hospital, including recently the acquired collaboration, other branches, almost 28 branches across the India. So they'll be having in a centrally one software called InterSystem Tracker. InterSystem is a company, Tracker is a software. It's called electronic health record or health information system. Okay, so the patient, it will care, after the patient come to the hospital, from the admission, from the registration, lab, pharmacy, other consultation, for doctor's notes, nurses notes, everything will be there in the software. They don't have to, next time if the patient can come with the, without any file, they can go to the any Manipal hospital, their data will be captured. Okay, and another interesting thing is, for example, as a clinical pharmacist point of view, I got an opportunity to interact with the pharmacy in charge HODs or clinical pharmacy HODs to solve their queries and concerns as part of the track here. And we'll be mainly focusing on the implementation of the software. So one doctor, for example, one doctor is prescribing 5 medication for a patient. Okay, so the drug number one, for patient come with the complaint of fever and maybe a lower abdominal pain, an increased frequency of micturition wheels, it's a UTA, and doctor will be having some set of prescription, drug number 1, 2, 3, 4, 5. After entering the drug, if the doctor is clicking the enter proceed button, it will show one pop-up. If there is a drug-drug interaction, one pop-up will display in the screen. It will ask, the same clinical pharmacist work, it will ask, there is an interaction between the drug number A and B. So, what this interaction is telling so and so, whether would you like to proceed or do you want to make the changes? So that is called the clinical decision support system. That means the Manipal, they're incorporating artificial intelligence in the digital health. That's very interesting, where I got a chance as a clinical pharmacologist to work in this area. Okay, so another example, if there is 5 medication, they're giving tablet pantoprazole, also syrup, some antacid. So both are in different dosage form, but both are same antacids only. So it will give a pop-up screen like there's a drug duplication, but they are giving same medication. One is tablet form, one is in syrup form, but both are same. Is it by mistake? Would you like to change? Make the changes? Would you like to cancel one and proceed? So after taking the decision only, the doctor can go for the intending. So that moment before reaching patient only, it will capture lot of the intervention, lot of medication errors. It will capture. So it will reduce the error rate. It will increase the work pattern of the. It will make the work of the doctors more ease. It will increase easiness for the nurses as well. So that is the one thing of the this area called healthy informatics. Also one of the area where clinical pharmacists will be working more desk based. Okay. So yeah, that's one of the thing I would like to add. It's called health informatics area, where nowadays many AE and ML are incorporating in this electronic health records. So this is also will be an interesting thing where CP can work as a desk-based platform. Yeah.
Thank you very much, sir, for answering the question. Now I would like to ask another question, which is like for both of you, and that is, what changes do you think could be introduced to bridge the gap between academia and clinical practice?
So, yeah. So one of the most important changes needed is that colleges offering such programs like clinical pharmacy programs, either B.Pharm or M.Pharm in pharmacy practice, they must ensure that proper clinical exposure is being given for the students. That is one important thing that the colleges and authorities like PCI, before giving any approval, they should ensure that the students are getting proper clinical exposure, because this course is all about clinical exposure than theory. It is more focused on clinical exposure. So that is the first thing. And yeah, and a major drawback in India is that in many colleges, faculty without adequate clinical background is teaching the PharmD or M.Pharm pharmacy practice students. For dealing with the theory, that is enough. But when it comes to clinical practice, clinical knowledge, and other things, proper clinical background is important. So, and also doctors, they do not like when we go for clinical rounds and all, doctors, they do not actually have time to teach the PharmD students or M.Pharm pharmacy practice students. So there should be someone responsible as a like the better person is a clinical pharmacist, a trained clinical pharmacist with a hospital background. That he's the better person to teach these students regarding the clinical aspects. So what I feel is, during a clinical rounds, a clinical pharmacist should be there along with the doctors to teach the students on clinical pharmacy aspects. So that is the one thing which we are lacking in Indian education system. So these two are the most important the gaps that should be bridged, I feel. And also one more thing I want to add is, in our there are like several limitations in our syllabus as well, because when we are when we are into practice, we get more queries from the nurses and other healthcare professionals regarding the IV dilutions, administration techniques, and all these things. But in our syllabus, we in very few things we learn about all these aspects. So our syllabus should be it should include all those aspects which are really needed for a clinical practice. That is what I feel. That so that is one of the major gap.
Yes, definitely. And Hafisa, would you like to add any points?
Yeah, actually, I completely agree with Krishna Suresh. It was a very important point. As she told, if the pharmacy college is appointing one, clinical instructor, or clinical pharmacist for, in the hospital, it will be very great thing. So that students, whatever they're learning theoretically, they'll get a chance to see hands-on training under one trained or experienced clinical pharmacist, how they are doing that CP job in the real life patients. So they'll be getting even in NABH activities, how they are doing, how they are documenting, how they are working. So before going to the market only, they are getting an hands-on exposure and trained people means it is a very great thing. And one more thing I would like to add, thing apart from that one is like, as Krishna told, to improve the clinical exposure. Most of the time we'll be having internship in the last year. So even they're getting minimum exposure from second year, third year, will be having some presentation. We can increase that exposure. See the MBBS students, they'll be having until afternoon theory. After that, they'll go to the hospital and they're whatever they learned, they are doing, on the real life. They're doing the practical in the everyday after. Similar way for families also. If you are implementing something like peer learning system or in a bedside teaching, okay, so they'll get a chance to work out on the real life cases. Even the peer learning, the concept is, as I told before, if they are every monthly, all the family students are having a kind of meeting, okay, or every one day in the week, so that each peer group, each intern have its own peer group from first year to fifth year. So they'll be, presenting one cases one by one. And, for example, every week there will be discussion of one case. So the peer group will be discussing from the, for example, first year student will be discussing about the anatomy of that disease. Second year will be discussing about the patho. Third year will be on the, pharmacology. Fourth will be so in that order, from whatever that peer students can contribute, like that they can master, and the last internship student will be discussing the cases. So this kind of will be, they'll get a good exposure from the starting to end of a disease. They'll get a good exposure. The peer learning concept is very good. We also recently introduced here, and the, as you told, bedside exposure also one good thing. Plus, along with that, one final thing is like, interdisciplinary learning. Even the family, if in a university, the family students plus the MBBS student, other healthcare can have a collaborative workshop sometime. So it will also improve their, communication and the close loop communication, in attention to details. So it's such a kind of collaborative workshop will also, they'll get a, more tendency to become more strong in communication between the other healthcare disciplinaries. So these things can be implementable in most of the colleges to improve the, PharmD program. And I think for Krishna ma'am, maybe can, she's working as an IT pharmacist, infectious disease pharmacist. But in our curriculum, we are not learning much about the, the actual antibiotics, how clinic, well, coming to the clinical, how we can, run the antimicrobial stewardship program, what are things we should be aware about. I think that thing can be added in the curriculum as well. Correct, no, Krishna ma'am? Am I right?
Yes, yes. We actually learned some 12 principles, which I do not remember even now,
Yeah, we are
regarding
not
the
learning anything
antimicrobial
in the
stewardship. We
curriculum.
don't learn that regarding the antimicrobial stewardship and all. That is what we learned just in theory. And also microbiology is something I
Something.
personally, I personally did not give much concentration into.
Yeah, yes.
But
So
now I have.
university, yes. Universities
Then
can consider revising their, curriculum by
yes.
incorporating more of this area, like antimicrobial, about the infectious disease things, antimicrobial stewardship, how it will be, because that is one of the global threat. I think by 2050, going to be one of the number one killer, more than the cancer. So this area, the, universities can take an action to implement these topics as well in the family curriculum. So they can also become a good part in the healthcare team, regarding, preventing the resistance of the hospitals.
Yes. Thank you, ma'am. Thank you, sir. Now I would like to ask um, the last question, which is not the least question, but something that everyone looks forward to. And my question to both of you is that where do you see the future of clinical pharmacy heading in India? And what would your message be for students watching this who want to become a clinical pharmacist?
So, regarding the future of clinical pharmacy heading in India, so clinical pharmacy is definitely growing in India, and it is promising to see that many private hospitals are appointing clinical pharmacists as a part of their healthcare team. And with increasing awareness about this medication errors, antimicrobial resistance, rational drug use, and all these things, the demand for skilled clinical pharmacists, it will continue to rise. And I believe that with this specialization in clinical pharmacy, as as we have already discussed, oncology, infectious diseases and all, this will, like, pharmacists will become expert in that particular field, and we will be able to contribute more meaningfully to individual patient care. And also, the future is heading towards precision medicine and personalized medicine, which means that each patient receives a safe, effective therapy based on their clinical profile. So, in this aspect, clinical pharmacists will definitely play a crucial role. Okay, and also with the right policy and training, if clinical pharmacists are integrated into the healthcare team, they can definitely contribute a lot more, and they can make big changes in the healthcare field with their contribution.
And sir, would you like to say something?
Yeah, so I am exactly agreeing with the what Krishna told about the future. Like even we are having more future in, as I told, in kinds of personalized medicine for pharmacogenomics. On this translation research may is one of the booming areas where we are having a futuristic, very wide scope. And also, even other thing is like recently, even compared to the old scenario, from the only dispensing, now we are end up in a place. Even government also started implementing, giving clinical pharmacist they're making eligible clinical pharmacists also eligible for the most of the government job. That's the good thing we can hear. Recently we are seeing from different states when we put nurses, even the gazette also passed in some states, the clinical pharmacist eligible for more, all the exam, governmental exam, whatever it's the railway exams or army exam. Many people are not aware about these things. The pharmacists can also work, also go for the army and navy field or merchant navy, something like that. Means we'll be having 6 months, in the land, 6 months in those things. So, but after farm, they have to do some three more courses from the motion. And then apart from that, army pharmacist, other government railway pharmacist, where they'll be, or even in our army pharmacist, recently they called. The thing is like, as a pharmacy or as a pharmacist, if you are going in the army, we'll be having we are an army, will having respect, and as a healthcare profession inside the army will be having more respected, and we can give more contribution to the community for the society. Okay, so we have to people have to explore in that area. It's one message also I would like to give to everyone. So explore the different domains that clinical pharmacists can go in. As in many of the government exams, as I told, they implemented the clinical pharmacist also eligible for that one. And apart from that, some message, two messages I would like to give to the people who is watching this one, or all the fellow clinical pharmacists or the family interns. One thing is like you have to update your, profile is very important thing for your future. So it's like, you start doing how you can increase your profile. Start doing, start participating in your research activities from, first, from normally they are having their research in the fifth year. So start participating in the research activities from the second year, third year onwards, like collaborating with you, with the clinical pharmacists, or collaborating with your seniors or your teachers. And so, because nowadays for the clinical pharmacists to withstand in the field, we need the strong research background as well. We have to, for getting job also, it is very competitive in abroad. We have to show our research profile as well. Even they will not accept all the predatory journals. We want a proper quality journals. And initially for us, people used to tell me, like, you are going as a clinical pharmacist. Why you are focusing on the research, what are entire area? But now things are not like that. Research is very important. And also they have to keep on updating their LinkedIn profile. What are the good activities, good achievement they are getting? They have to keep on activity, because nowadays many people are getting job by through LinkedIn is a better platform for networking and getting job. Some companies will directly, they will review the LinkedIn profile, how active the person is. So keep on activating your LinkedIn profile. And also you become part of some good organization like in FCPI. As a better, you can improve your profile. You get a lot of FCP will give you a lot of opportunities. Their main vision of the FCPI is there should be some good skilled clinical pharmacists should emerge from the country. So the very good intention, they're like running the organization. So if you have become the part of FCPI, me and Krishna ma'am, we are the part of the FCPI in different forums. We'll get a lot of, we can improve your profile. You will get a chance to represent yourself in a, national, international workshop and conferences. That's a good platform. And there are like in the other organization for families, you can become part. That also improve your profile. And one thing I would like to add is like, you can become part of the competition, which is or clinical case study competition for pharmacies, which is organizing in national or international level. That will be definitely improve your profile. For example, in Manipal recently started one. Last year they implemented a med ministry program. It is a clinical case study competition. For attending that one, people have to first clear the college level competition, and whoever the winners only will be eligible to go to the national level. The thing is, like, if they are representing their college to participate in national level clinical case study competition, it's a prestigious moment for the organization. Even I was the judge, one of the judge for the ministry program. So even, like, I got some insight. I'm also sharing with other family students, like, in such a kind of program, if you're representing, you can see clinical pharmacy, students, our family students, very from different colleges, you can make a network, and so also one of the good area they can participate in this kind of program, and they can one. So another important last final message which I would like to give from our side is, like, for whatever the job, if you are doing as a clinical pharmacist, whatever the things you are doing, keep patient as the center of the discussion. At the end of the day, society have to get some benefit from out of us. Okay, so if we are able to save somebody's life because of our intervention, if we are able to prevent the medication error, and if we are able to contribute to the patient safety, that satisfaction, somebody got benefited, somebody's lives got saved, that will be with us, that will be inspiring for us to work more. So keep the patient safety as the center of our all the approaches, and that is the one message finally I would like to share.
So if you want to, what I want to tell to the students is, if you want to pursue clinical pharmacy, you have to, as I mentioned before, you have to prove yourself. So this profession demands a lot of clinical knowledge and real clinical exposure. So start developing these skills when you are right in your college, right in your college. And there are several platforms which offer quality content. Do follow them. Networking is important, as Hafiz said. Be active in LinkedIn. You follow those people who provide quality contents as well as good opportunities. So network, yeah, follow and being a part of FCPI. This is again a way you can network. You can develop your network. Like, this provides a lot of opportunities, as what Hafiz already told. And one more thing is, you have to identify your area of interest when you are in your college, and work towards that. And never miss an opportunity that comes your way. Never miss any opportunity to learn and expand your knowledge. That is very much important. Then also, yeah, I will also like to tell one thing. I remember once our chairman referred to us as the gate stoppers, which means that the last line of defense, preventing harmful medication events reaching the patient side. So what we have to realize is, it is a huge responsibility. So because it directly impacts the patient's safety. So don't take it lightly. Do like, we prepare yourself for this huge responsibility with utmost commitment and passion. That is what I have to tell the students and those clinical pharmacists.
Absolutely, ma'am. And by the end, like, all I would like to say is a very big thank you, because this opportunity I got to interview you guys. It was really wonderful to interact with you guys and know so much, because it was like so much insightful and enriched knowledge that I could get from this one. And this was definitely one of my best experiences, where I'm helping myself as well and others as well to know as much as possible about clinical pharmacy. And I would like to thank FCPI and both of you for giving me this chance to interact and know more about it. And definitely, um, I think this is very good, very beneficial for our students.
I
Thank
would
you,
And
like to add,
Suchita,
like,
and
thank you so much. Thank you so much for the opportunity, and it's very great thing, as, like, as a BPharm student, she is in the her level. She is a lot of people having the similar queries, so she is, like, doing a very good thing for the society who is like more students. Even Krishna ma'am told like what she's doing is a really great thing. A lot of people are going to get advantages by spreading the awareness. And you can also come up in future like this more sessions, because people need these kind of sessions for deciding their future. Am I right, Krishna ma'am?
Yes, yes, this is a great initiative. We should appreciate her for that. And also
Yeah,
thank you for
appreciate Kritika.
choosing us for this.
I'm like very grateful for this because uh, this is like my first time, and in the first time I got a chance to work with FCPI. So it's a really big thing for me, and in the future I will be working for more initiatives and bringing more such content for pharmacy students.
Very good to
So
hear that.
Great job.
yeah, thank you very much.